Dr. Hook, and it's a pleasure to serve under your chairmanship. I'd also like to draw attention to my declaration in the Register of Members' Financial Interests. Before examining what needs to change, I want to acknowledge the work of staff in the sector. This has a personal element for me. My dad managed nursing homes, and my mum was a deputy sister in a residential home caring for people with dementia. I know how hard staff work each and every day. Pay can be low, and recognition can be lacking. Likewise, the care workers who support people in their own homes do so much. We only tend to see their importance in reverse, when the lack of a placement or support prevents hospital discharges. We do need to go much further in integrating our approach. Last month, I helped launch a report by Look Ahead Care and Support. Unlike most of the reports that land on our desks or in our inboxes, it called for reforms that wouldn't cost money. In fact, taxpayers would save money. Look Ahead looked at one element of integration, supported housing. They estimated that nearly £1 billion could be saved each year by extending integrated mental health, social care, and supported housing services across England. The report is a robust analysis of how supported housing keeps people with mental health problems out of institutionalised care. This means more than just savings. The online launch began with a video from service users, which, had the hair standing on the back of my neck. One man told us how it was the first time he had ever had his own private shower. He said it makes him feel like a king. These are small, but incredibly significant and humanising differences. We know there isn't enough money to sustain the social care system as things stand. Any way to make savings while actually improving outcomes must be seized. Yet only a handful of NHS trusts and local authorities are adopting an integrated approach. And in my view, this missed opportunity comes down to culture. And I'm not casting aspersions. The system just isn't geared towards different organisations working together. Outcomes are what matter. And for most, the goal should be helping people to live as long as possible independently away from institutionalised care. Lasting reform requires innovation and leadership from government, but also political courage on part of the opposition. If social care funding is left as a political football, we know who's been kicked around. 2 decades have seen at least a dozen white papers on social care reform. The right ambitions are easy to state. It takes legislation and political will to achieve them. And as we emerge on the other side of this pandemic, the need for these services is only going to grow. The Prime Minister has given us a roadmap for leaving lockdown. A roadmap for integrated social care would be as profound as the creation of the NHS.